Welcome back, everyone, to The Art of Divergence, brought to you by Neurodivergent Ohio. I'm Heather.
I'm Sammy.
The information provided on this podcast is intended for informational and entertainment purposes. It does not act as a substitute for the diagnosis and treatment of mental health concerns.
Thank you, Heather. And today we are going to be doing our part 2 of talking about older adults with ADHD, the challenges they face, and the treatments they might need. So last time we talked about why it's important for us to pay attention to this issue, what the big areas of, missing significance in training and treatment are. So this time we are going to talk about diagnosis specifically. We talked about misdiagnosis due to anxiety and depression or hormonal issues in some of our past episodes. And additionally, misdiagnosis can frequently occur over age 55 because it's a time in life we most closely associate with different types of cognitive decline.
And there's also a lot of life changes that individuals experience, retirement. So structure and routine is going to change, changes in lifestyle due to physical and mental health issues, aging, causing a change in dopamine levels, which include help me find the word, Sammy.
Motor skills?
Okay,
that works.
I don't know why that was so hard. Motivation, memory, and pleasure. That's everything that dopamine tends to work towards.
And then when they do try to seek treatment, unfortunately, they have to deal with this bias of the medical community in its lack of training, potential ageism, and just big blind spots in order to get a proper diagnosis. With all of these things, all of these factors we have to weigh and consider. A lot of the time, it's really not as simple diagnosing a 15 or 25-year-old with ADHD as it is a 65, 55-year-old. So there are so many more specifics that go into it that we really have to pay close attention to, but we really fail to do without proper training and direction.
For sure. Yeah. The older generation, didn't have much research on the diagnosis and treatment of ADHD. So they're learning about it now as they're approaching that age, and how can I manage this?
That's especially true when we think about who is in the medical community. I mean, we have a lot of people of our age group in our late 20s and 30s and whatnot, but there are also still a very large portion of the medical community that is themselves over age 55. So just like the people coming to them about concerns are maybe not very well versed, they also don't have this frame of it being involved in their medical school training or in their continuing education that they got in their early years. And, as we saw this develop, they had a very different perspective. So I think that's important too, that the groundwork wasn't laid well for them. And that unfortunately it has to be like a new effort for us to incorporate this into everybody in the medical community and their treatment priorities. So first, let's establish the fact that, as relates to all the blind spots we're talking about, research suggests ADHD is still significantly underdiagnosed in adults, and there exists a clear lack of training in our field about this subject. I just talked to a person and it ticked me off so much. It happens like every couple days with one of my clients as they tell me about a provider that doesn't understand ADHD. Basically, this person went months and months trying an ADHD medication and an anxiety medication, and they felt like it didn't work, and they were still having all of these emotional regulation symptoms and impulsiveness and executive dysfunction. And they go to their doctor and he says, well, ADHD is mostly about focus, so we'll just have to figure something out, maybe just try a different stimulant, come back in 3 months. And this person was experiencing depression, anxiety, a lot of these things that we're talking about that are not directly the attention issue. And it tells me, once again, just day to day, there is a glaring, once again, blind spot with what we as clinicians and providers notice to be the needs and challenges of ADHD versus what the very stereotypical, very old idea of what it is, So just also to preface before we go forward, we are still focusing on some of the concepts and topics talked about in the book Still Distracted After All These Years by Kathleen Nadeau. And in this book, she brings up a study by psychiatrist Dr. David Goodman, who specializes in treating adult ADHD. in 2012, which found that out of nearly 2,000 primary care doctors, only 8% felt extremely confident in their ability to diagnose and treat adult ADHD. And only 28% of psychiatrists, the prime people we go to treat these things, felt extremely confident. So that gave me a little bit of pause, and I was like, what is going on? Like, obviously all of these sources are telling us there are big areas of just a lack of knowledge. And like we said before, the aging population 55 plus is rapidly increasing, and we will see a big shift in age demographics in our country in the next 10 years. So we're really unequipped for this age shift, especially in the population that's going to be looking for services from us. So, a majority of the time, you'll see when an older adult has noticeable cognitive symptoms, they are automatically referred to these places called memory clinics, which are generally geared toward seeing what kind of dementia you might have or if you do or don't. They aren't really looking for any neurodivergence. And it seems just like a symptom of this belief that ADHD is a young people's condition, that you grow out of it, that it, even if older adults have it, it's easier to handle in later life. And studies even show us evidence of this gap in knowledge. The book that I am referencing for some of this information has a couple stories about unfortunate experiences where older adults and their very concerned partners and family went to these memory clinics, got a diagnosis of some sort of dementia, and unfortunately were not helped by the treatment or weren't even really given very good treatment to handle the struggles of that, started to question if it might be something else, and got diagnosed with ADHD, got on medication, and actually saw improvements. And so, I mean, what can come with that is a lot of grief over the fear experience, the frightening experience of being diagnosed with dementia, and the loss of time that you might have had functioning well when you might have gotten a proper diagnosis initially as you started out this process. So I think that just shows it's really important to understand the pipeline, the system, the way these things work. A note on just like the institutional view we have of these things and the macro view is that sometimes people like us in our role where we just see kind of any old client coming into our private practice to get service. We don't necessarily have like a direct referral source or facilities or hospitals. It's just kind of anywhere and everywhere. Sometimes these facilities and hospitals do direct people to specific places to get specific diagnoses that they already kind of expect them to have. And then there's this bias created. So there's a big challenge in combating that.
I mean, that is something to take into consideration is like medical ageism, right? So we have people who joke, like, I'm just getting old, right? So that's a symptom of just getting old. And that's something to be mindful of when going to the doctor, right? It's people tend to feel helpless or hopeless or unimportant because some of their symptoms are either dismissed or considered a low priority, or again, you're just aging, you're getting older. And that can be discouraging.
Absolutely. And I think there's also room to consider that older adults' perceptions or abilities to mask or unfamiliarity with ADHD symptoms also plays a part. Underdiagnosis can occur because adults have gotten to the point where they worked so hard to learn how to mask these symptoms or didn't even know they were symptoms, thought they were just problems or flaws and wanted to hide them because of the negative feedback they might have gotten. And, they just develop compensatory strategies. They might also struggle with perceptions of certain traits as symptoms at all rather than quirks or just the way someone is. You hear that a lot of the time from, older family members and whatnot. Oh, they've always been like that. That's just the way they are. They're not going to change. And then we have the benefit as people in a younger generation of a exposure to tons of content about neurodivergence, whereas that is not something that the older generation is getting exposed to if they are not using the same media on the same platforms, reading the same materials as us. So then we get into what else it could be. What else ADHD symptoms might be misdiagnosed as, or what might look like ADHD and potentially be some form of dementia.
And I know we talked about dopamine and how that's all related to motor skills, motivation, all of that. But you also have different parts of the brain that come into play here. So, like your frontal lobe, this is important for things like decision making, behavioral changes. Your hippocampus, it's typically the first area impacted, and the struggle with short term memory. Temporal lobe, language comprehension, difficulty with words, right? So, those are all symptoms of things that can be related to ADHD, but also Alzheimer's, dementia, other cognitive things. So, next, we're going to jump into a list of diagnoses that tend to get confused with ADHD. One of the one we kind of hit on already in a previous podcast, perimenopausal cognitive changes, right? Where that change in hormones, especially in the later years when all of those hormones are starting to disappear. Then we have different dementia types: Alzheimer's, cerebrovascular disease, vascular dementia, Lewy body dementia, rest in peace, Robin Williams, mild
Ugh,
cognitive disease. Yeah, it was a hard loss.
I mean, Bruce Willis too, right?
Yeah, yeah.
Oh, don't remind me. Okay, go ahead.
Mild neurocognitive disease, so things like increased difficulties with activities of daily living, increased need for assistance, possible confusion with simple cognitive tasks, noticeable increases in mood, anxiety, and emotional overreaction, worsening cognitive performance. Parkinson's is a big one. Any traumatic brain injuries or brain tumors, infections like UTIs, sleep disturbances, or sleep apnea. Those are really big within the ADHD population and also for individuals with other cognitive issues. And then we have like normal age related changes in cognition. So, for example, slower speed of processing, reduced working memory, executive functioning abilities.
And I mean, just as a reference to one of these things, I think this is important for us to list because I didn't even know that in older adults, UTIs cause cognitive issues. I had no idea of that. My grandmother, before she passed last year, had UTIs and was having difficulty with speaking, difficulty answering questions, understanding time, and we were having a big confusion about why that would be. And someone said, "Oh, it could be a UTI," and I was like, "What? Why? What would that have to do with anything?" It does. Unfortunately, in older adults, you can be at risk for cognitive issues with UTIs. So even something like that would be worth considering when some of these symptoms come up. So another piece of this that can get associated into the diagnosis realm is the cognitive decline that's also associated with unhealthy lifestyle patterns. So researcher Dale Bredinson found that unhealthy lifestyle patterns like unhealthy eating, poor sleep habits, little to no regular exercise, lack of medical self-care, and the like go hand in hand with ADHD in showing those cognitive decline symptoms. Also, we see people with ADHD struggling to maintain those things, so that can further complicate things. It's really hard to suss out. But thankfully, that research also told us that a significant improvement in healthy lifestyle choices can show reversing cognitive decline, which is awesome and a little bit less depressing for us. So now I'm going to get into what the diagnostic differences for us could be as providers that we might need to be aware of to make a good distinction here. The main difference that helps us decide between all of these things we just listed is that the presence of symptoms has to be long term for ADHD, not a noticeable onset later in life.
Yeah, so one of the big things is how health symptoms manifest and are shown to other people, or how they come out. Hyperactivity is a big one, right? In the earlier years, we're more hyperactive. It kind of shows, right? Bouncing off the walls, things like that. As you get older, it might look more like restlessness, right? Having a hard time just sitting still or getting tired easy of doing a specific task. It's rare that adult ADHD occurs alone and without co occurring diagnoses like anxiety, depression, sometimes even autism.
Like other mood disorders and things like that, emotional processing and whatnot. A lot of
Indeed.
the time, any age of adults, ADHD is going to co-occur with something. Another factor in confirming the diagnosis, which is a little bit later in the game but does help affirm the what's going on in the situation, is that ADHD medicine works for people with ADHD. So you're going to see an improvement when you try ADHD. If it's cognitive decline from other things, it's probably not going to show that much of an effect. And in continuing with going through the diagnostic process, obviously, our first part in diagnosis has to be a really good interview with client and family, accurate reflections of that person's life, both now and in the past. It's got to give a lot of insight on very specific measures, and we need instead of just the checking the boxes of all of the things that we look at for anybody's general ADHD. And we need to suss out whether this diagnosis is correct and avoid confusion by asking the right questions. We are facing a lack of specific measurement tools and questionnaires created for older adults rather than just the general population of adults 18 to 99. And like I've said before, we have our assessment tools for specific ages of children. Sometimes even like in their 20s, we have specific measures for, I guess, any ages of adult. We have specific measures for specific tools, but we don't really have a questionnaire geared towards older adults. We don't have measures specifically targeting their unique challenges. So presently, the best tool we have to make an accurate diagnosis is that clinical interview and knowing those questions to ask and red flags to watch out for. And that really only comes from training and exposure to this population. You have to be committed to knowing what beyond the basic foundational ADHD stuff you have to see. And developmental science tells us a lot about the cognitive differences we face in older adulthood. So as mental health clinicians, we have to close that gap in targeting these approaches to this population.
Yeah, in addition to that, like really, really tailoring it to the specific client instead of the general assumption of somebody who is 55, 65 plus. Being able to ask for examples. What does that look like? How has that changed over time? So you're kind of taking a walk through their path rather than, like Sammy said, kind of checking the boxes. And you can really get to know like what it looks like for the client in their daily life.
And I think that about sums up our diagnostic topic we wanted to get into. And we will have a third part that we get into about older adults and ADHD, specifically related to the treatments that are helpful for them to seek and some of the other challenges they might face in other parts of those treatments and factors of help in making progress. So thank you for listening to The Art of Divergence. This has been Sammy and Heather. We hope you join us again next time for that third part. And just as a reminder, we are part of Neurodivergent Ohio, an Ohio-based private practice offering counseling, community building, and assessments to ADHD people of all ages, autistic people, anybody with these challenges that might want to explore more. Please check out the links in our description and head to our website for more info. Thank you and have a nice day.